Welcome, guys, once more to another episode, the second episode of erectile dysfunction, right? So today in this episode I'm going to mention something on vascular erectile dysfunction, right? So in the first episode I did about psychogenic erectile dysfunction, right? So in this episode I'm going to do something on vascular erectile dysfunction, right? So again, what is erectile dysfunction? Let me just define it for repetition. So erectile dysfunction when a man has difficulty achieving or maintaining a firm erection throughout sexual activity, right? So you may have difficulty in achieving erection, or you may have a difficulty in maintaining erection throughout sexual activity, right? Yes. So I'm going to speak specifically about vascular erectile dysfunction, right? So this is when you have difficulty in achieving erection or maintaining erection firm enough for sexual activity, right? Caused by medical condition, right? The first one was about the psychological causes, the psychological factors that can cause it, right? So here we're going to look at factors that can cause erectile dysfunction that are not psychological, right? Yes. So talking about vascular erectile dysfunction, what do I mean? Vascular comes from the word vessels, blood vessels, right? So we have a neurotransmitter called nitric oxide, right? So nitric oxide is a neurotransmitter that plays a very, very important role as far as your erections are concerned, right? So nitric oxide is always released from the blood vessel, something called vascular endotheliums, right? So it is always released from the blood vessel, right? So it acts as the ignition for erection, right? So it plays a very, very important role as far as your erection is concerned. So vascular erectile dysfunction, it comes from the blood vessels, what we call vascular endothelium. So from the blood vessels, there is a release of nitric oxide. So a nitric oxide plays a very big role as far as your erections are concerned, right? So anything that affects the blood vessels, anything that affects nitric oxide levels, anything that affects blood circulation in the blood. If you can remember, we mentioned that when you have a flaccid penis, right? When you are not sexually activated, you are not sexually active, right? You don't have an erection. The amount of oxygen in your penile tissues, right, is between 20 to 40 millimeters of mercury, right? When you have erection, right, this amount almost triples to between 90 to 100 millimeters of mercury, right? So that means that oxygen plays a very, very big role as far as your erections are concerned. Nitric oxide plays a very, very big role as far as your erections are concerned, right? So, and blood circulation, right? So anything that affects the blood circulation in the body, anything that affects nitric oxide levels in the body, these things, right? Anything that affects these levels, the nitric oxide levels in the body, the blood circulation in the body, and anything that affects the blood vessels in the body, sum up to what we call vascular erectile dysfunction, right? So anything that affects the levels of these things can cause you to have vascular erectile dysfunction, right? So having mentioned this, what are the causes of vascular erectile dysfunction? Right, so we have many causes of vascular erectile dysfunction. So the first one is obesity, right? You have obesity. So in obesity, especially around the belly, you have a lot of fats, right? So you have maybe big tummy, right? You have a high likelihood of having erectile dysfunction, right? Because in obesity, it can complicate to high levels of hormone we call prolactin, right? So if you have high levels of prolactin, prolactin levels when they are very high in the body, right? They induce something we call hypergonadism, right? So they cause the production of gonadotropin releasing hormone to fall, right? If the release of gonadotropin releasing hormone decreases, what happens? The testosterone levels will decrease, right? And if testosterone levels decrease in the body, what happens? You will have your problem with your sexual life, right? Because testosterone plays a very, very big role in your in the human sexual response cycle, right? So obesity, you have a lot of fats, right? You are likely to have high prolactin levels. If you have high prolactin levels, the levels of testosterone will decrease, right? If the levels decrease, I think your gaze is good as mine, right? Yes. So manage your weight, right? Apart from obesity, we have poor blood circulation. Poor blood circulation. What happens? I mentioned that when you have a flaccid penis, where that is when you don't have an erection, the amount of oxygen between in your penile tissue is between 20 to 40 millimeters of mercury, right? Yes. If you have an erection, this amount doubles, right? Between 90 to 100 millimeters of mercury. So what does this mean, right? The amount of oxygen in the penile tissue is increased by blood circulation, right? So you need proper blood circulation in your penile tissues, right, for you to get a proper erection, right? So anything that affects the blood circulation in your body affects your erection and can affect your sexual life, right? We have conditions like diabetes mellitus, hypertension. What affects? What happens? Diabetes mellitus or hypertension, they can damage your blood vessels, right? If they cause a damage on your blood vessels, what happens? The nitric oxide production is hindered, right? Is affected. So if the nitric oxide production is affected, what happens? You may have a problem with your ejaculation, right? Because nitric oxide is one of the most important neurotransmitter as far as your erection is concerned, right? Yes. So poor blood circulation in your body can cause erectile dysfunction. Can be you can maybe having maybe diabetes mellitus, maybe you are hypertensive, right? So hypertension or diabetes mellitus can cause damage to your blood vessels. Production of nitric oxide will be affected. What's the result? You may have erectile dysfunction, right? So apart from poor blood circulation, apart from obesity, right? We have what we call sedentary lifestyle, right? Lack of physical activity, right? Maybe you are just you work from office, you work from home, right? You don't walk, you don't do exercise, right? You are physically inactive, right? When you are physically inactive, what happens? The blood circulation, if you are active physically, the blood circulation in the body is somehow reduced, right? If the blood circulation in the body is somehow reduced, right, and we have to achieve a certain amount of oxygen in the penile tissue for you to get strong erection, between 90 to 100 millimeters of mercury, right? So if there's no good blood circulation in the body, what happens? You may have a problem with your erection, right? And this can cause you erectile dysfunction. Right? Apart from poor blood circulation, apart from obesity, apart from lack of physical activity, that's lack of exercise, we also have hormonal imbalance, right? So hormonal imbalance can cause you erectile dysfunction, right? So we all know that testosterone plays a very, very important role as far as the sexual response cycle is concerned, right? So anything that causes decrease in the levels of testosterone can affect erection, right? For example, you have maybe high prolactin, right? We linked it to obesity. If you are obese, there's high likelihood that you will have high prolactin levels, right? So if you have high prolactin levels, it affects the production of gonadotropin releasing hormone, right? This if the release of gonadotropin releasing hormone is affected, there will be a decrease in the production of testosterone, right? Something we call hypogonadism, right? So if you have low testosterone levels, right, you may have a problem. You will have a problem with the erections, right? And this can cause you erectile dysfunction, right? Apart from that, we have smoking, right? Smoking, yes. Smoking can make you have erectile dysfunction. How? We mentioned that for you to have good erection, there must be production of nitric oxide, right? So if the levels of nitric oxide, if anything affects the levels of nitric oxide, right, and they are you have little production or they are totally not produced, right, you may have erectile dysfunction. So what? How does smoking cause erectile dysfunction? So when you smoke, right? Smoking damages the walls of the blood vessels, right? Yes. So with time, the smoke destroys the walls of the blood vessels, and we say that nitric oxide is produced from the vascular endothelium, which is inside the blood vessels, right? So if there is a destruction in the walls of the blood vessels, right, the production of nitric oxide will be affected, right? And you will have difficulty achieving erection or even maintaining erection for given duration, right? Yes. So smoking causes a disruption in the walls of the blood vessels. The production of nitric oxide will be affected, right? Yes. So smoking is one of the causes of vascular erectile dysfunction, right? Yes. Apart from smoking, we have neurological conditions, right? Neurological conditions. For example, you have maybe spinal cord injury, right? Right. So spinal cord injury can cause it can affect your sexual life, right? You have spinal cord injury, it can affect your erections, right? So it can hinder your erection, right? So maybe you have spinal cord injury, maybe you have multiple sclerosis, right? This can be disposed to erectile dysfunction, right? Apart from that, we have heavy drinking, right? So heavy drinking again, heavy alcohol drinking, right? Heavy alcohol drinking can affect your sexual life, right? So how does it affect your sexual life? Heavy drinking can lower your libido, right? Apart from that, it can cause a decrease in the levels of testosterone, and as you know that testosterone plays a very, very important role as far as the human sexual response cycle is concerned, right? And this can predispose you to erectile dysfunction. So just in recap, you've mentioned we have mentioned about heavy drinking, smoking. We mentioned something about obesity, right? We have mentioned about hormonal balance. We mentioned something about poor blood circulation, right? So these things can predispose you to erectile dysfunction, right? Yes. So once again, I hope you learned something. I hope it was some sort of learning, right? So the next episode, I'm going to do something about management, right? How can you manage erectile dysfunction, right? I'm going to do something about the homemade. How can you manage it at home, right? You can manage it at home, right? Or you can even attend to your healthcare provider, right? Yes. So that is the video for today.